Good morning. What would you like to discuss today?
I would like to have a breast augmentation. I would like to be larger than I am, and I wanted to know what method is best for me.
Okay, what I would like to do is I would like to start by giving you an overview on my concept of how to do a breast augmentation and what your options are. Then I'd like to examine you and I'll make very specific recommendations for what's best for you. And then we can sit down and look at pre- and post-operative pictures so you'll get a sense of what my style of breast augmentation is. There are two different types of implants available for us to use. One type is a saline implant, and that implant is filled with saline fluid. Saline fluid is the same type of fluid that you would get in an intravenous. So we know that that material is very safe and is a very natural substance. The other type of material is silicone, and the type of silicone implants that we use now are called cohesive gel implants, which means that if we were to cut the implant in half, it would be like Jell-O. It's not a liquid, and it's sort of a semi-solid. Any implant that we use has a slight risk of breaking or leaking, and if a saline implant leaks, well then it's a very natural substance that your body just absorbs. If a silicone implant was to leak and it had a cohesive gel inside, it would just stay exactly where it is and not leak into your body. There are other considerations in doing breast augmentation, and an important consideration is where we put the implant. I like to put the implant underneath the pectoralis major muscle. If you look at your chest, there's the breast, there's your pectoralis muscle, and then there are your ribs. It's my feeling that it's very important to put the implant underneath the pectoralis major muscle because the risk of scar tissue forming is much less, the breast looks much more natural, and thirdly, it makes mammograms easier to do. So the question comes up of what incision do we use? We have to get this implant in to a pocket underneath the muscle, and there basically are four types of incisions. There's an incision in the armpit, there's an incision around the edge of the areola, which is the pigmented part of your nipple, there's an incision in the crease of your breast, and there's an incision in your belly button or umbilicus. I think after I examine you and we see exactly what you want to accomplish, I can make the recommendation of what incision would be best for you. Saline implants and silicone implants are going to give you the same look after surgery. The only difference is that the silicone implant might be a little bit softer and more natural feeling. But the option of whether to use saline or silicone will be entirely yours, and we can talk more about the advantages and disadvantages of each after I examine you. The surgery is performed either in the office, in our operating room, with a board-certified anesthesiologist and a full certified operating room, or it's performed as an outpatient at the hospital. The surgery takes about an hour to do. It's done with a type of general anesthetic where you're breathing on your own and you wake up very quickly. Once the surgery is done, you stay in our recovery room for about an hour where we make sure that you understand all the post-operative instructions and that you're comfortable, and then your chaperone will pick you up and take you home and spend the first night with you. What we like to do in our office is at the end of the operation, we like to inject a long-acting local anesthetic into the area where the surgery is. So we put in a medicine that lasts about 10 hours. So when you wake up, you have no pain. And then when the pain starts about 10 hours later, we like you to take a combination of a muscle relaxant like Valium and a little pain medicine. You're going to need to use that for about 2 days. Someone who works at a desk or a computer or doesn't have to do a lot of physical work is usually back to work in about 4 days. Patients will always want to know when they can go back to the gym and exercise. I usually tell patients that they can do lower body exercises in about a week, and they can exercise their upper body in about 3 to 4 weeks. I generally wouldn't plan a skiing vacation or any vacation that requires a lot of upper body strength for about 6 weeks after a breast augmentation. What I'd like to do now is ask you whether you have any questions about what we've discussed, and then I'd like to examine you and go further with making recommendations specifically for you.